A lot of times anxiety isn't always clear at first what it is, and it just sort of follows us around.
I see trees of green, red roses too. I see them bloom for me and for you, and I think to myself, what a wonderful world.
Hi, I'm Sandy McGatha. I am a licensed clinical social worker. I've got a background in community therapy, mental health, and I worked as an administrator for an inpatient acute care psychiatric unit for adults and geriatric patients. And so I'm now a part of Arrow Senior Living as their social worker, and I work with mental health advocacy for clients, residents, families, that kind of stuff. And today we're just kind of getting together to talk a little bit about anxiety, maybe educate ourselves as well as anybody who watches this program. Debbie, can you tell me a little bit about yourself, please?
Sure. My name is Debbie Dewey, and I am a resident in the Rockside Vitalia in Northeast Ohio, Northeast Cleveland. I had to think of where I was.
So I wanted to talk a little bit about anxiety. What is your background as far as, did you work outside the home, or what was your job?
I did many things. The two most important things to me really had not a lot to do with this subject. I loved gardening, and I worked for a garden center for about 20 years. At the same time, fitting in between retail and the rest of the world, I worked for a school system for about the same time, but different hours, obviously, because I worked full-time at the school. And the thing that I worked with the most were the teenagers. I was a study hall monitor. I worked in the library. I worked in the cafeteria. And basically, I was the person who signed the passes and got in the middle of a conversation that needed to be quieted down or absolved or out in the hall or you're going to the office. I mean, I had to be the big bad person with the stick. But I came to love a lot of the kids. So I saw anxiety without realizing I was seeing anxiety. I also want to bring up, not necessarily here, but there's two instances in my life, a great example of what anxiety can do, but I won't bring it up now.
Well, we'll get to that. Let me ask you this. Since you have some experience with anxiety, how would you define it? How would you kind of explain it to somebody?
Anxiety? I think anxiety is probably when life overwhelms you, that you feel like you're in a corner and that you can't see a way out. That would be my.
I think you're right. It's one of those things that I think when you have this sense of dread or overwhelming feeling, and it feels like it's always with you, and it starts to interfere with the way that you actually function. A lot of people kind of get anxiety and being nervous sort of confused. When you're nervous, you can still kind of function. You can still do the things you need to do. And usually you know why you might be nervous. Maybe it's nervous to do this video or to have a certain thing that you have to do. A lot of times anxiety isn't always clear at first what it is. And we just know it's there, and it just sort of follows us around. So, right. Are you comfortable sharing a couple of examples of how you handled anxious times?
Well, when you have kids in a high school, you have groups and you have groupies.
Yeah.
I think the biggest thing I saw was the separation of the kids who were very, very bright, but who were ignored, by the kids who were very, very athletic, or what else could, or very good in music. I mean, it was specific areas that only specific kids could belong to that group based on their abilities. And sometimes that put them away from a great deal of the kids who really could have enjoyed being part of something that they never thought they could before.
Okay.
That I think that's the biggest thing, in involving people who would stay in the corner by bringing them back into the light, and that in of itself is helping both the person who's doing the inviting and the person who hopefully is receptive to being invited. It's got to be a little bit of give and take on both
Right.
sides.
And so you kind of watched that when you were working with kids in high school, which is a very hard time and sometimes very anxious time to grow up. And then you're doing it now in your community there where you live. So I think that's kind of cool how you've carried that forward. How do you think anxiety played into these young teenagers and being sort of apart from others? You think that was probably a hard thing?
Well, it depends on what group you're talking about. Now, I'm going to use some very common descriptions, but you had the nerds.
Yeah.
Okay. The nerds, when I was in school, were the ones who had the pocket protector with the pens, and computers really had not come into their world yet, but it was very, very close. And they were very, very much ahead of the rest of their generation as far as that went. I think another group were the kids who had, they had them carry over from the 50s into the 60s, were cars, who had it, who didn't, who had their license, who could park in special parking because of their age or whatever. That, and then you had the very bright and musical kids, you had the very bright and brainy kids. You also had a group of kids that didn't seem to fit anywhere. And those were the ones, I think, who got lost first.
Right.
Then you had some of the very, very bright and beautiful and talented who nobody realized there was anything wrong until the ultimate thing happened. And I was part of one and very aware of the second.
How did being a part of something like that affect you?
Well, I have to throw some personal in here to answer that question. My mother died right after my 16th birthday. And she died of cancer. She took care of all of the things that had to be taken care of. My father was in Alaska. And eventually he came home to a wife that couldn't be fixed, couldn't be, made well. And I think he was lost. I think he didn't know what to do. He was a person who was always been in control, but he couldn't fix Mom. And even though I'm talking about this now, and it happened 52, 53 years ago, this part of my life is still part of my life today. So to answer your question, how did something from then control what you do today? I never forget my mother. The then and the now, in certain circumstances, are parallel. They have many, many, many things in common. You've got to be able at some point separate them, because none of these things should rule your life.
Right. I imagine that was a hard thing, losing your mom at 16. That's an extremely important time in a young woman's life. And you had a lot of things that you had to probably figure out on your own and work through. I bet that was very hard.
It was. It
Mhm.
was. And I didn't realize till years after that event how much that colored my life.
Yeah. It seems like you've done well and made good decisions and actually grew up to kind of help other people. So I think that's also sort of a sign of the good work your mom did before she passed away. But it's very hard to be a motherless child at that age. I totally get that.
Yeah. And the
Do you
rest, the
think,
rest of, I'm
I'm
sorry,
sorry, please go ahead.
the rest of the family had to deal with it in their ways as well. I had two younger brothers. I had an older brother who was 11 years older than me. At the time of my mother's death, that was our entire family. My father ended up marrying 2 more times after mom died. And the first one lasted 2 years and nobody was surprised. The fourth one, they ended up being married, I think, for 25 or 26 years. In that marriage, I acquired a stepsister who was 4 days older than I am, and we are very good friends, and a stepbrother whom I've not seen since my father's funeral in 1999. So I still have contact with the other part of my family. And I'm glad I do.
Yeah. Well, you mentioned that you'd had moments of your life or anxiety, or where you've certainly had brushes with moments of anxiety. What do you think, or how many actual anxiety or different kinds of anxiety disorders do you think that there are? Do you have any
Oh,
idea?
many. Oh, I imagine many, and I think it's probably not even based on one subject. You would have to base it on one person.
Yeah, it does have to do a lot with your genetic background. It
Yes.
has a lot to do with things that have happened in your life. Some people say people with certain personalities will be more prone to anxiety than others. A person who has a lot of things happen, if you've hit with a death, or you've hit with a change of jobs, or a change of housing, or you've had some other example, having a baby can cause anxiety. There's that change in the way that your life might be. So lots of things can sort of trigger it. I also think it has something to do with our resilience, our ability to kind of bounce back from a situation. And a lot of times people have the ability to bounce back or be resilient based on the support that they have in their life, based on the people they have in their corner. And so that does make a big difference, I think, in how people handle anxiety. A lot of times, people have panic attacks. And I don't know if you've ever known anybody who experienced a panic attack, but there's kind of a physical response where you kind of sweat, heart palpitations, chest maybe hurts a little bit, and you can't quite catch your breath. It's a very scary thing. And a lot of people I know feel like they're going to pass out.
I've had one.
Have you had a panic attack?
One. And the scariest part of it is I was driving a car.
Oh, okay.
And it was one of those things, get over, see what's around me, figure out what's going on, and get where I have to go safely.
Right. Good way to think it through. Good job.
I had no choice.
Mm-hmm.
I had no choice. And that probably was one of the scarier things that has happened to me with my mental health. And just because we're talking about this on a one-on-one basis, I have had help over the years probably the last 10 to 12 years the most. And it gets me through the day. But I'm still reliant on the help.
When you talk about the help, what does that mean?
I have a psychiatrist and I have a counselor.
Okay.
Both of them offer a different view on things and help me see that this wasn't bad and this was good. They're completely different. That's the best way I can explain it. One is my age and one is probably in her 40s. So I have a broad spectrum of help.
I understand. You know, and as a person who works in mental health and has for the past 20 years or so, I'm a big proponent of seeking professional help, to go to a therapist. There's so many different modalities of therapy that will be helpful, you know, cognitive behavioral therapy, dialectical behavioral therapy. There's so many options. Medications are good too. And actually they say that that's the golden ticket to do both medication and therapy, because they work such hand in hand, you have the best results. And I personally believe in the world that we live in now, and certainly coming off of 2 years of COVID and some of the things that people have gone to, it is a more anxious time.
Yes,
There's a lot of uncertainty. You turn on the TV and you see that. So the fact that there's more people that have anxiety now doesn't surprise me at all. Not everybody seeks out the help though. And so I have to applaud you for doing that, because a lot of people will try and do it by themselves. And to a point, you can maybe do it by yourself. You can practice, you know, good sleep habits, practice eating well, exercise, you know, kind of expending some of that energy. But if it feels like it starts to really interfere with your ability to function, probably seeking professional counseling or talking to your primary care provider or a psychiatrist is really a good option, because no one wants to live like that, in that sort of state of.
It's tough. You know you need it. You wish you didn't. You try to make as best a day as you can in your life each day.
Right.
Now, having said that, it takes less than 5 minutes for that to go right down the drain.
Can you give me an example of what you mean by that?
Sure. I'm trying to put together a farewell party tomorrow. I have a card that I got on Amazon that didn't end up being what I thought it was. It was something that was about 4 inches square, and it had a little tiny necklace on it that had a hummingbird on it. And underneath that, there was a poem about that. I got this Monday or Tuesday. I've lost it. It's in my room. It's in my apartment. I have to find it. So that kind of right now, stress, anxiety. I mean, there's other irons in the fire with this party. I'm involving more people than me. And to top it off, I find that I have a dentist appointment that I cannot cancel. So I'm going to be late to my own creation, if you want to call it. That is one episode of anxiety that nothing, trying to work through it or ignoring it, at least initially, helps. I mean, sometimes it's right in front of you and you just can't see it. Sometimes you can look for 25 minutes and still not see it. You can go into the other room to get something and oh my damn, there it is.
I've been there.
But I haven't gotten there with this one yet. So it's, ask me that question again, because I've gotten myself off. I
think I was asking sort of, I I think I mentioned that I thought it was so great that you chose to get help to sort
Yes.
of address some of the things that were going on with you. And then you had said, well, it is good until something happens and it just goes right down the drain. And then you kind of told the story. But, so what I do in a case like that is I back up and I bunt or I punt. I back up and I rethink it. And so I'll get her address if it's a farewell party, and I'll make sure I have that. And when I find that, if I don't find it before she leaves, I'll make sure I have her address and I'll send it to her. So
Yes, and that's something I can do. And I can
Mhm.
say the things that the poem said without having the words there.
Right.
She's going to be missed. She was basically my first friend here.
Okay.
Yeah, and she happened to be my next door neighbor as well. So there is a lot that I'm going to miss physically. And on top of that, she's 10 years older than me, which I couldn't
Wow.
believe. The people here don't look their age, and I don't know whether they had the elixir of youth in their past, or whether they're just have good genes. I don't know. But Jude is a quiet person compared to me. I've never seen her lose her cool. I've seen
Mhm.
her be upset, but I've never seen her lose her cool. She's just a good person, and damn it, I am gonna miss her. And there's no
She's
two ways
lucky to
about
have
it.
a friend like you to do a party for her. And in
Yeah.
the end, it's all about the fact that you thought to do a party for her and to let her know that you're going to miss her. That's the real important message here. And it's wonderful that you got a card with the hummingbird, but it'll get to her. And the dentist appointment, while it's unfortunate, you'll still get there too. It's just
Yes.
life's little moments kind of bump us around, don't they?
Oh, yeah. Between
Mhm.
doctor's appointments and dentist appointments, yes,
Yeah. And so that's
yes.
that resilience piece, your ability to kind of flex through all the things that kind of happen, bend,
Mhm,
don't break kind of things. And some days are
mhm.
harder than others, I know, to do
Yes,
that.
yes, absolutely, absolutely. Despite your best efforts, sometimes you keep walking into the wall.
Okay. So is this one of those moments that you kind of think I feel sort of anxious about it, or you feel like you got it under control and you're going to get through it?
I'm gonna get through it.
Yeah, I bet
One
you
of the
will.
other gals is gonna help me go through my room because she's not been living in it for the last,
Mhm.
umpty months. And she will see something based on my description that I could be standing right next to and not see.
I do that too. It's
Do you
easy to
lose your
do.
phone?
Uh, when I've got it in my hand, I sure do.
Yes.
I sure do. I'll be looking over. It's funny because we do a lot of things on autopilot, or I do. I mean, I've got lots of things happening and I might
Mhm,
go from here to here. And then I realize, did I do that? I don't know, but I did it. So,
mhm,
it's one of those things that happen with busy people. You have lots going on. Sounds like you
mhm,
have a lot going on. You're trying to plan this party, you have appointments. So it
mhm,
makes sense that you might not remember every detail, but you're getting there, you're doing it.
mhm, mhm.
So that's
The
good.
It was so much, I know hindsight is 2020, but it was so much easier when I was younger. I could do multitasking without even thinking about it, literally moving from one room to the other and being ahead of myself and getting things done,
Hmm.
and be able to plan for the next day while I'm still in the middle of today. Um,
Right.
my memory, my memory is playing tricks on me. Um, I have so much that I could be doing that I haven't done yet, and we won't get into that. But it's one of those things that follow through, follow through, follow through, follow through.
Mhm.
And when I get tired of it, I say, pitch it.
Yeah. So I try and think I just can do one thing at a time right now. So what's the thing I'm going to do? I'll just do
Hmm.
this thing to the next step, and then I do the next thing, and then I do
Hmm.
the next thing. It's kind
Hmm.
of like taking that time. Well, let me ask you this, because it sounds like you have lots of good advice and you tend to help people there in your community, and you're kind of a mixer and a matcher and a mediator, a liaison type person. If you knew somebody in your community who was having issues with anxiety, what kind of advice would you give them?
Well, I'd ask if they were alone.
Okay.
here alone. And if they were not here alone, and they had a spouse, a good friend, someone, another friend that I didn't know that was aware of that person, I would kind of bring them into a conversation if I could. Now,
Okay.
they might not be here. They might be at another facility. They might still be in their home. They might still be living with a child,
Mhm.
which the older we get, I think is harder to do. We become set in our ways and we like things the way we like things. I never thought I'd ever hear myself saying that. But
Yeah.
if you can bring people to a situation that you're pretty sure it would help, that's kind of what I try to do. It doesn't always work, and sometimes it backfires. But that's kind of what I would try to do if someone was obviously hurting.
So you
What
would
can we do?
include them. You would invite them
Yes,
to join in with the group. Okay.
yes, yes, yes.
And
And
that
sometimes
helps.
it does, but you don't have that option every time.
Mhm.
And even at our age, we still have insecurities, we still have frustrations, we still deal with um, aches and pains so much more than we did when we were younger.
And
Um,
sometimes that can increase anxiety if you don't feel well,
yes,
if you routinely
yes,
don't feel well or have aches and pains.
yes,
Mhm.
yes. And getting up and walking is not just an easy, get your body up and go do it. You've got to think about where your hands are, where your feet are. Um, you've got to get up carefully, because if you don't get up carefully, you're going to be on the floor.
You don't want that to happen. Right.
And
Right.
it's happened too many times to me. Um, I am a fall risk. I'll tell anyone that cares to know.
Mhm.
I am taking physical therapy. Um, I'm trying to be active here with uh, exercise classes. And what is the thing that Gobi does? What is that called?
It's like meditation stuff.
Okay, we have a wonderful gentleman who helps us get through the day and ends the day with meditation, learning to do that. So those are the kinds of things that I hope to be able to say I've done,
Mhm.
and hope to be able to say it's helped.
And those are all things that I would suggest as well. I might add picking up a hobby or doing something that physically makes you, like you talked about doing gardening before,
Mm-hmm,
working with your hands
mm-hmm,
in the dirt,
mm-hmm.
smelling the
Oh, yes,
soil. Yeah,
yes. This time of
physically being
year,
active.
oh God,
Mhm.
this time of year, I go nuts because all I want to do is get down on my knees and get my hands in the dirt and plant something. Well, getting down on my knees is dangerous, literally dangerous. And being able to get my hands in the dirt is something I'm going to figure out a way this year. I'm
Maybe
going to
sitting at a
figure out a way.
table and doing it. Maybe you have to use dirt that's in a pot or in a big
Mhm,
bag, but you still
mhm,
get to touch it and smell it.
mhm.
But that's an excellent one. Sitting in the sun and just
Yes,
soaking up the
yes,
sun is
yes,
helpful.
yes,
Like
absolutely.
meditation, mindfulness is another one that they talk about, where you kind of do guided imagery and you sort of see yourself on the beach, or you practice some of these moments where you sort of calm your breathing and practice breathing. That's a great thing for anxiety.
Oh,
Kind
okay.
of breathe in and breathe out. Um, Listening to a calming kind of music and just sort of
Mm-hmm,
relaxing.
mm-hmm.
So you guys have you're already doing great things there if you're practicing meditation and working with your hands, picking up hobbies, reading, if you can function with reading. Some people can't if they're very anxious because their mind sort of races, but
And I'm a reader. I'm a great reader. I
it's an
almost
escape,
always
isn't it?
have a stack of books on my nightstand that I say, all right, I haven't started this one yet. And why not? Well, you've been lazy and you've been watching television and you've been playing with the cat, and you're pushing your reading away, and in fact, reading is what grounds me.
I like the word you use, grounded. That's a very good word to describe it. You kind of want to ground yourself when you're
Mhm.
feeling anxious.
Mhm.
Nice job, Debbie. One of the good things about, and so I agree, there are things we give up as we age into another level of our life, but we also, in giving up those things, make room for other things that it's kind of cool to pick back up and try. We have more time for some of these things, and we maybe even have a different kind of patience level than we had when we were younger. So
You're not trying to prove it for anybody else except for yourself.
Yep. Yep. I agree with you. That's excellent news. I want to go back for just a minute and touch on, I understand it's probably very hard to pick up something and have a memory attached to it and have to decide what to do, because that's why we keep those things around, because they have memories to them. And so I definitely feel that as you tell that story, I know that's got to be a hard thing, a challenging thing. So as you work through that, I will wish you the very best as you kind of work with your family to sort of decide what happens to some of that stuff. But I hear you, and I would feel the same way. I would absolutely feel the same way. Before we let you go here, I wanted to kind of just make sure that we've caught everything that you wanted to say about anxiety. I have a few more things I want to make sure everybody knows about anxiety, and I wanted to make sure you had a chance to finish.
Well, I have
up
a list of questions that I could ask you, and if you want, we could go through them
It's up to
quickly.
you, whatever you want to do, ma'am.
But there's something that I definitely need to add at the end that
Okay.
is important to me.
Okay.
We have covered what anxiety disorder is, more or less.
Mhm.
But we haven't said definitely what causes anxiety. What
So anxiety can kind of be
disorder?
caused by a lot of small events that sort of build up into one big event. It could be a big traumatic event that sort of changes, as a child losing your mom, that might have been an event that could have triggered a feeling of insecurity, uncertainty, anxiety.
Mhm.
And people with different personality types might be more prone to anxiety than others. If you've been in a situation where you've been abused in some way when you were younger, or even as adult, that could cause anxious moments, that sense of trust. A lot of it, I think, also comes from our ability to believe that we can handle whatever situation comes. And sometimes if we've been injured in some way, we've lost that confidence that we can handle it. And so even if we could handle it, we don't feel like we can, because we've had something that sort of injured us. There is anxiety that is genetically based. Some people, if you have parents who have anxiety, you may be more prone to have anxiety. So there's some of those kinds of things that figure into it.
Okay. Is there more than one type of anxiety disorder?
There's like a generalized anxiety disorder. That's one that this kind of, and that's an actually DSM-5 diagnosis that a psychiatrist would give or a therapist would work with. Generalized anxiety, there's not anything in particular that you pinpoint, but you just have this general feeling of unease that kind of sits with you all the time. Obsessive compulsive is like the OCD, where you're very concerned about how things go, or you might wash your hands multiple times, or you might go back and check the door multiple times. So that's also a DSM-5 diagnosis. Panic disorders or some of those things, like you said, you kind of had a panic attack one time driving, but there are some people who have them very regularly.
Yes.
There's that sense of, and that's a very scary thing, to never know when you're going to lose that sense of control over your body. And that sometimes even the anxiety of worrying about an anxiety attack can make it harder.
Right.
Post-traumatic stress disorder is a kind of anxiety, the trauma of something that's happened, and you're sort of always a little bit hypersensitive to things that are going on around you. Maybe you have memories that will throw you into, it's a sense of not feeling like you have control over your body or your mind, because there's always something kind of lurking that could throw you into a sort of anxious moment or panic attack. And then there are people who have what they call agoraphobia, or social anxiety, meaning that you don't want to leave your house. It's even hard to go to your mailbox. It's hard to go be in public with a bunch of people around you. That's very real. I've certainly counseled folks who have had that, and that's very things that we take for granted. Our ability to walk out and go to the store and buy groceries are not afforded to all people.
Right.
those are the top ones.
Okay. How prevalent are anxiety disorders?
It's interesting, the adults, and just in the United States, there are 19% of adults, or 40 million people, have anxiety disorders, and 7.2% of kids are showing signs of anxiety. So,
Okay. I'm going to tell you a story, and then I'll try to keep
okay,
it short because I have more things that I'd like to say.
okay,
When I was in high school, there was a young woman who was gifted. She sang, she acted, she was a good student. She didn't push people away, but she didn't encourage people to come to her, and yet she was surrounded by people all the time. The last week of high school, she had been out. We'd heard she'd gone to the hospital, and we weren't ambulance chasers then. She went to the hospital. Oh, I hope she's okay. She came back to school, and she had gauze bandages on both arms at about the wrist level. And I know I asked her, I says, what's that? She says, oh, I had to have some blood work done. I had to have some testing done. I says, oh, okay. Didn't think anything about it other than I'm glad she's back. She's here. She'll graduate and all that stuff. About 10 years later, and she was multilingual. About 10 years later, when we had a high school reunion, there was a lot of buzz going around Friday night. And I happened to walk close enough to hear somebody talking. And they said, did you hear about, and I'm not going to say her name, did you hear about so-and-so? And they said, no. She said, well, it's awful. She was a multilingual person in the sense that her language was what enabled her to be the person she was. She climbed up a scaffolding on the house next door to her house and jumped off of it and killed herself.
Oh, wow.
And the other episode that I wanted to quickly tell you about was also a classmate, same class, same year. And he too was exhibiting not normal behavior. He was a pianist for a huge Methodist church near Albany, I think, Albany, New York. And he was the piano player, so to speak, organ player. And another friend of ours that we had in common was also at that church, and she was the choir director. She was also a music teacher in the school district that enveloped this area. My girlfriend called me, and she was in tears. And I said, what's the matter? And she said, so-and-so, so-and-so hung himself in the pastor's house so that he would be seen by anyone who came through the door. This person I had known most of my adult life. And it was one of those things where I told my husband, I said, I'm going to the funeral. I'm going to leave Friday after I leave, get done with work. And it was one of those things where you didn't know what to do when you got there. He touched so many lives, but he couldn't get the help he needed.
Right.
And I don't think anyone who knows him could say anything more than that. It was a very, very sad day.
So you've had several losses kind of traumatic losses. You know, you talk about this last person this gentleman, and that's one of the things, not everybody who is depressed or is struggling it's not easy to see. Some people it is easy to see that they're struggling. Some people, but it's not as easy to see in all people. And so that's one of the things to be aware of. Depression and anxiety tend to walk hand in hand. Usually if you have one, you may be prone to have the other one. So I'm really sorry about those losses. That's a lot of things for you to think about.
And I've carried them my entire life. So
Yeah.
it's not been anything that I've taken on. It's sort of been laid on me.
Right. Those experiences. We are a culmination of all the things that have happened to us throughout our lives, both good and bad, aren't we? Well, I wanted to kind of, let me just say these last few things, and I'm going to probably wrap this up for us. But the last couple of things I would say is that people who have anxiety, they can't have physical symptoms. So it's important to pay attention to physical
You
symptoms.
say they can?
They can. You can have physical symptoms. If you have anxiety, you're more likely to have maybe health problems as well, because if you constantly have panic attacks, issues like that, it may cause higher blood pressure, it may cause cardiac issues. So being aware, and like you talked about, people with anxiety can try to manage it for themselves, but ultimately, if you can't, there's no shame in asking for additional help or finding some additional support to live a better quality of life, to have a more comfortable life, make the most of it. Actually, anxiety can cause your hands and feet to be colder too, which was an interesting thing I thought I would share.
Well, I always have cold hands, so I don't know where to go with that.
Well, I do too. Or you can have memory issues with anxiety. So, and women tend to be a little more likely to be anxious or have anxiety issues. So those are just little tidbits. As we focus on Mental Health Month, we kind of wanted to educate and talk about those things. And you've been an excellent guest to talk with us and share your stories. Any last thoughts, Debbie? And we're gonna wrap it up.
I think the people who need help, people should be more aware and not brush something off that they see, but they don't want to deal with it. And that's hard, because if you don't want to do something, you're not going to do it. In not doing that thing that you don't want to do, I think you're hurting yourself as well as the person who needs the help.
Excellent. All right, Debbie, thank you so much. I appreciate your time.
Thank you very much. Bye-bye.
Bye-bye.
And I think to myself, what a wonder